Justin Nambatia was born this way, a cleft lip, palate, hands and toes. One of her eyes also often swells and releases pus. Justine has not breastfed from birth because her cleft lip would not allow her to latch on her mother's breast. With her mother now absent, her father has had to figure it out on his own. He is a hawker and walks hours vending bags in and around the city, but it's a hustle. He hardly makes enough money to cater for his needs, let alone 8-month-old Justine's special needs. But she is his biggest priority.
Sisobola kulya nga sinnamuwa kyakulya. Amala kulya ne bwe mba mpuliranga enjala emmalawo. Amala kulya ne ndyoka ntandika nange okufuna ekyokulya kuba manyi osooka kulabirira muto.
Her mother abandoned home when Justine was about 2 months old. Lule is not sure why his wife left, since he had never known her to be problematic. But he suspects it has to do with the way his family shabbily treated her. She was with him when they first made contact with Kosu, a rehabilitation hospital for people with disabilities. But he will go it alone on the 24th of August when Justine undergoes the first surgery to correct the cleft lip and palate.
Cleft is an English word to just mean a separation in what was otherwise supposed to be joined together. The first part of the surgery is to help close the gap. And in closing the gap, we are making them look like children. They may afford to smile. And that also helps the mother know they are going back with a child that looks normal.
The healing process after surgery is fairly simple, but most critically, the guardian has to always keep the wound clean.
The biggest worry is when they feed all sorts of feeds that will again cause separation of the stitched up area. So we really emphasize soft feeds that may range from breast milk for those that are really young.
Kosu offers this surgery free of charge, but Lule is worried of the period when he would be too busy taking care of his daughter, yet he has to eke a living. Friends and others with similar experience advise Lule to buy for Justine special shoes, but he says he cannot afford them. Kosu advises against surgery for the hands and feet.
The worst thing to do to them is do any form of surgery that makes them look better but not work better. Now, we can do something for the hand and try to make it look like a hand, just close the gap and hope that all that will be good. But these children learn to compensate. They learn to make with the deficit they have. And so as they grow, because they don't know that they don't have a particular problem, they will learn to hold objects, write. And so we usually don't address that. Instead, we help them through physiotherapy to make with what they have.
Dr. Masambu explains that cleanliness is the surest way to stop eye infection. But it's tough for Lule, who walks miles on dusty and sometimes clear roads to sell his merchandise. On the day we visited, Justine had a fever, so she was irritable, not as playful and happy as the day we first met Lule. Each time Justine falls sick, the father takes her to a clinic in Kamtuza, Masaka, where she has been treated since she was a newborn.
Wabula twakunganya abaana ab'obulemu. Bwe nalaba ab'obulemu nga tuli bangi era nga we bali bangi neeyongera okuguma. Kuba neeyongera okuguma ne mmanya nti ke tuli awamu oba oli tunasobola okwerwanako. Era neeyongera okuguma nenyongera okuba n'omwana oyo era omukazi we yagenda saatya.
If this is the first time you're receiving a child with a cleft, definitely you get depressed, you will wonder because the child just doesn't look normal. Okay, so one of the things we do is to make sure that the mother or the father, or both parents for that matter, are aware that this condition exists and that it is treatable.
Children like Justine sometimes suffer for long because the parents are ignorant and easily buy into claims that their children have been bewitched. This also creates stigma where people avoid the child. Lule's mother cautioned him to watch closely over her, that such children are needed for ritual sacrifice.
Wabula yangamba kuuma omwana wo ng'ekyatika kuba bangi baagala nnyo abaana abo bakozesa ebintu byabwe bye baagala. Wabula mukuume wonna w'oba oli ne bwe kuba genda mu manju afazaali bw'oba osobola yingira omutuuze ebbali wakiri omalirize emikolo gyo.
Dr. Masambu says there is no known cause of cleft lip and palate, hands and feet, but he adds that there are some environmental factors and associated drugs that have been found to be unsafe for pregnant women, smoking during pregnancy, and some genetic factors as well.
We can't point at the man.
No, we can't. No, we can't. Unfortunately, out there in the community, they may think it's a curse or something like that. But like I said earlier on, you have no particular cause. It can occur to anybody. It can occur to certain families because of the genetics, but most of the patients, they're just what we call sporadic cases. It occurs in just one individual, and that's all they know for the rest of the other children they have.
Children with disabilities are one of the most marginalized groups in society. According to UNICEF, about 2.5 million children live with disabilities in Uganda. Only 9% of the school-going age attend primary school, and just 6% go on to secondary school. Uganda ratified the Convention on the Rights of Persons with Disabilities in 2008, but there is a serious gap in implementation of the regulatory framework, mainly due to lack of coordination between government institutions and civil society organizations working to improve the lives of people with disabilities. So what does Justine's future look like in the circumstances?
We are trying to push Parliament to come up with good policies where these children are brought on board. You are aware that in education there is an issue of special needs, whereas again government does not put emphasis on those teachers who are handling special needs in order to deliver education to these children. Because for me, I believe when you are educated, even that disability can be forgotten.
A member of Parliament for People with Disabilities, Helena Samo, says the parents of these children need to find organizations that deal with disabled children and seek help. COSU, for example, carries out such operations for free, and in 2016, it handled over 200 children with similar cases. The hospital, situated off the Kampala-Entebbe highway, is a partner of a non-profit organization, Smile Train, that provides corrective surgery for children with cleft lips and palates. Josephine Karungi, NTV.